be moving on to breast cancer. We have all discussed about chemotherapy, targeted therapies for breast cancer. Today's brief topic will be on a specific combination of oral treatment. So we have a lot of patients who cannot actually tolerate IV formulations or have exhausted options where this kind of metronomic treatment can be used. So what is metronomic chemotherapy? It is use of frequent low dose of chemotherapy over long periods of time to actually target the tumor angiogenesis and minimize the toxicity. And it is used as initial or in subsequent lines. So we use it in subsequent lines mostly in resource limited areas, patients who have low performance status. So this is the pathway. So they had tried this to go for research for this kind of therapy from 2007, and then in 2020 obviously with a phase 3 trial it was patented for further use. This has high single activity, single agent activity with good safety profile. It is used, two drugs are used together, capecitabine along with cyclophosphamide. Why? Because we can see here capecitabine is absorbed through intestine through 3 different enzyme pathways, and cyclophosphamide being another oral drug synergizes the upregulation of this pathway and then helps in the further mechanism of the drug to work better. So this slide shows that how it is actually helpful. It is helpful in showing anti-tumor clinical effects. So the first trial obviously showed that there was better PFS, OS and response rate outcomes with this combination. That was the first one, and then after that there has been several trials like the Penelope project, which has shown that combination of oral drugs on metronomic doses have been helpful. Next came few phase 2 studies which have tried this combination of 2 oral drugs in different dosage formulations, and then finally we have the phase 3 trial which was actually published from Tata Memorial Hospital with the enclosed phase 2 phase 3 randomized study, which was a multi-center randomized study. So in this they have a particular capsule which is made of the formulation of the 2 drugs, and there are 3 dosage levels which were used. We usually start with the first dosage level and then move on to the third and to check the toxicity and the response that happens. These are the key inclusion and exclusion criteria. What are the endpoints is that the best overall survival, overall response rate, and also the disease control rate. The adverse effects were well tolerable. And when given with cyclophosphamide, there was an increased concentration of capecitabine, which made the drug more permeable to the tumor tissues. The challenges were also met because there was less impurity generation, good particle size with differential release of the drug. This is a picture of the drug, which is actually coming in formulations with the cyclophosphamide and capecitabine in a single capsule. And it has been shown that this has a very useful for established metastatic breast cancer patients through phase 3 clinical trials, and also it has got a flat dosing concept. We do not need to take too many pills together. It is more convenient for people, especially for people who have got poor performance and have got lack of options. It stands out to be one of the biggest options now to offer to a patient. Thank you.